No kidding.
Twice.
Wow.
100% more deaths if you're taking multivitamins. We're not talking about high dose. We're not talking about anything else. Just multivitamins. You're doubling your cancer death rate from prostate cancer.
Remember a couple of weeks ago you were talking about the fish oils also increasing your chance of...
Well, that's more information. In 2008, there was a review of all existing studies with more than 230,000 people who did or did not receive supplemental antioxidants. And the vitamins increased cancer and heart disease as well. And then there was another study from the University of Minnesota with 39,000 women who took supplemental multivitamins, magnesium, zinc, copper, and iron, and they died at higher rates than those who didn't.
Wow.
And the doctors concluded, quote, based on existing evidence, we see little justification for the public's general and widespread use of dietary supplements.
Wow.
And then 2 days later, October 12th, 2011, from Cleveland Clinic, again, another distinguished center, there was an analysis of 36,000 men who took vitamin E, selenium, both or neither. And if you took vitamin E, you had a 17% increased risk of prostate cancer.
Wow. So it increases the likelihood of everything, huh?
And the chairman of cardiology at Cleveland Clinic said, quote, the concept of multivitamins was sold to Americans by an eager pharmaceutical industry to generate profits. There never was any scientific data supporting the use.
So, Dr. Lederman, I guess my question is, why are these vitamins and minerals and things considered good for your body when they're in your diet, but not when they're in your supplements?
Well, that's addressed as well. All these studies haven't hurt the sales. The vitamin industry grossed $28 billion. So that was about the number that we multiplied it, right?
Yeah, that's my $60.
That's your $60 times 300 million Americans, up 4% from the year before. Wow. The head of a particular company whose store is down the street here said, we see no impact on our business, end quote, from these studies. How could it be? So Dr. Ofit says, how could this be, given that free radicals clearly damage cells and given people who eat diets rich in substances that neutralize free radicals are healthier, why do supplemental antioxidants show they're harmful?
Yeah, exactly. That's my question.
That was your question. Here's the answer. The most likely explanation is that free radicals aren't as evil as advertised. Although it's clear that the free radicals can change DNA and disrupt cell membranes, that's not always a bad thing. People need free radicals to kill bacteria and eliminate new cancer cells. When people take, like you, large doses of antioxidants, the balance between free radical production and destruction might be too much in one direction, causing an unnatural state in which the immune system is less likely able to kill harmful invaders. Researchers call this the antioxidant paradox. One thing is clear. High doses of vitamins and supplements increase the risk of heart disease and cancer.
Everything is best at a good balance, right?
And for this reason, not a single national or international organization responsible for the public's health recommends them.
Wow.
So what do you think about that?
Well, it's shocking, but I guess it does make sense in a way, intuitively, that, you're adding supplements kind of disrupts a balance in the body, doesn't it?
So that's why we tell people, look at the data. The data is so important. If you have a cancer and you're out there with free radicals, think again. I just had a patient who came to me this week, very intelligent man and wife, 69 years old, diagnosed in 2010 with rectal cancer. He's gone on all these supplements, free radicals, and antioxidants, and vitamins. He's gone to Mexico, Germany, spent lots of money for this rectal cancer. And you can imagine what's happened.
No, nothing's working.
The cancer's growing.
Oh, man.
And before there were no lymph node involvement. Now there's lymph node involvement. So I'd urge listeners, if this describes something like you've been going through, please give us a call. Most likely there's effective therapy out there that is based on scientific fact. Everyone wants to wish the cancer away, but cancer cannot be wished away, and these vitamins and antioxidant medications are not going to provide you with the kind of successful treatment that you want.
Right.
I just urge people to think about themselves, think about the data, and let's try to turn things around, get involved with successful treatment that's meaningful and gives you a chance to live and hopefully lick the cancer. And that's really what we want to do, is to try to lick the cancer in a reasonable, responsible way that has proof, and proof of time and proof of scientific data, and not just hearsay.
Yeah, that's right. And if they have any questions right now, they could call at 800-321-0710 to talk about their story, ask any questions they may have, and try to get some information.
All right, Dayush, who's my co-host today, wants to spend a few minutes talking about a personal reflection, and I'd like to give the microphone over to Dayush, and he's going to talk about his own personal issues, and I hope that you find it interesting, and again, we'll be back shortly. Go ahead, Dayush.
All right, yeah, so as you know, Dr. Lederman, cancer affects, I think, every family in America right now, unfortunately, and I'm no exception. Someone close to me has had cancer for over 10 years now, and it started with breast cancer, had a radical surgery there, then there was bladder cancer that got chemo and surgery and scrapings, and also colon cancer, which then spread to the liver, as it often does. And from there, it got into some abdominal lymph nodes and so on. So been through a lot, and it's always hard to deal with, not just from a personal level, but also medically, because, you know, as you always say, you got to look at the data, but when you're in the middle of the situation, it's hard to go out there and look for the information because you get overwhelmed. There's so much data sometimes all over the place that doing a Google search for trying to find the best treatment isn't easy. Of course, in my case, we were lucky enough to be in contact with you, and you've always steered us the right way, I must say. And that's why we ended up going with radiosurgery at a certain point, too. Obviously, there was a lot of chemotherapy involved, a lot of surgeries, the colon resection. We put the hepatic infusion pump, which is like a metal pump that goes inside the body, and it's sewed inside the body, and it has a catheter that links it directly to the liver so that they can constantly get chemotherapy from the pump that goes into the liver to try to treat it just kind of instead of doing a systemic treatment, which we also did that through a port, but you can also get local chemotherapy just to one organ that way. And I mean, that seemed really stupid in retrospect, because the damn pump just spins around in there when you're moving about. So every time you want to get the pump filled, the doctor's going in and trying to use moves on the abdomen to try to flip it back around. And that's kind of a headache, and sometimes it doesn't work. So now you got to get another operation to remove the pump out of the abdomen. And obviously, that's not just a headache to go back in and go under the knife and anesthesia and all these things, but it's just emotionally draining too. And that's what I think a lot of people have trouble with when it comes to cancer. It's not just that you're going through a difficult medical ordeal, but you're going through a difficult emotional ordeal too. So I know I'm not alone in this, and you've seen a lot of patients come to you saying thank you, and you know what it's like And I think that radiosurgery, of all the other treatments that we undertook, was probably the easiest one to deal with. You go in, you get your treatment. It's all outpatient procedure, and the success rate of the tumors you're treating is always so high and so reliable that it's the only time when we've said, all right, let's go get treatment, and it hasn't been draining emotionally. It hasn't been a headache to deal with. I mean, down to the location, everything is convenient. You go there, you get your treatment, and you get out. And it's been easy, and I must thank you for that. I'm going to do that now too.
All right, thank you for your reflection. And if you have questions about Daryush or their own personal experience, you're welcome to call him. We do have one caller, and I'd like to say hello to Sheila from Manhattan. And I understand.
Hi, Dr. Lederman.
Hi, good morning. I understand
I am baffled. I am so baffled sitting here.
Okay.
Listening to you.
Okay.
My husband is 73 years old, and he had prostate cancer 17 years ago at Sloan Kettering Hospital, and they took out the whole prostate. So hopefully we don't have to worry about.
Okay. So what's your question today?
So
you have to turn off your radio, ma'am.
All right. Thank you.
Okay. What's your question today?
So he's taken, I don't know, I'm just baffled.
Baffled by what?
He's taken this injection every 6 months, and he's on Eligard.
Well, it means he's on hormonal therapy, so it means exactly what I was talking about before. He had the prostate cancer removed surgically, right, at a big cancer hospital, correct?
Yeah, yes.
And it didn't work. That's exactly what I'm talking about.
Yes,
so
doctor.
It's nothing to be baffled about. It's exactly what I was speaking about earlier in the hour, that often surgery to remove the prostate can spread the cancer cells, it seems like, rather than to cure the patient. If the cancer was cured, your husband wouldn't be on hormonal therapy today. The whole point of treatment for prostate cancer is to cure the patient, to try to keep sexual function, keep urinary function, keep quality of life good, so that there's no treatments years later. And that's why I urge people to look at the data, and the data shows that our results are better than surgery. They're markedly better than surgery. And again, prostate cancer affects 200,000 people a year. Our results are 20, 30, 40% better than surgical results. There's no cutting, there's no bleeding, and you have a better chance of keeping the quality of life too. So don't be baffled. Let your lesson be a lesson for everybody. Before you take the knife or go to the proton beam, think about all the treatment options. Look at the data, and I urge people to look at our prostate booklet. It's free. We send it out, or better yet, to meet and go over all the opportunity before. Because once you have that prostate out, if that spreads the cancer cells, then that means that the cancer's never going to be cured. So it's really a critical point. I'd like to take other calls as they come in. Right now we're going to our break from our sponsor, who is so thoughtful they put me in as announcer. So we'll be back in a minute. For new or recurrent cancers, Radiosurgery New York specializes in new, non-invasive cancer treatment choices. First in America, first in New York, first for you, Body Radiosurgery Cancer Treatment. Decades of experience with primary and metastatic, large or small cancers. Cancer treatment from head to toe, acoustic neuroma to prostate cancer. We hit the cancer with no cutting, no bleeding. Hi, I'm Dr. Gil Lederman. We're the cancer treatment radiosurgery pioneers, with possibly a second cancer treatment chance for you, even if chemo, radiation, or surgery didn't work. Our cancer treatment is outpatient with most insurances, Medicare, Medicaid accepted. Minutes could change your life. Call me at 212-CHOICES, 212-CHOICES to hit the cancer. Ask us about hyperthermia, too. We're super convenient, 38th and Broadway in Manhattan. Call 212-CHOICES.